Hi guys, today I'm going to do a brief overview of biomedical science techniques, laboratory support number 1, the 4th assignment. In this assignment you'll be covering the P5, the M4 and the D4. So for each I will talk you through how you should address it, material to include and any other queries throughout the actual assignment. Okay, again setting the scene for task 1, we are working in a laboratory setting, and we are taking samples from patients to assist with diagnosis. So again, cells can be observed under a microscope to identify cell injury, aging and disease products. From the material that I covered with you guys during class, and also the links that I have put through BlendSpace, sent through email, you should have no problem identifying and addressing this criterion. So for a start, the purpose of biopsies and biopsying tissues is important to be aware of. I would also include maybe a starting introduction on normal cell structure and function, and include a paragraph perhaps on necrosis and apoptosis of cells as your introduction. For that, consider skin lesions, melanemic and inflammatory. Cancer cells can be found in sputum and urine samples, and also fluids of the chest and abdomen. Identify what might be observed and what this might suggest. So again, explaining melanemic skin lesions and also inflammatory conditions that are brought by that also to the cells. Speaking of cancer found in the sputum and urine, but also in the fluids of the chest and abdomen is also important. Okay? So that's for the P5 first, folks. Task number 2, again within the same scene and context. To study the identified cells above, samples are taken. Again, we've been looking at different ways in which we can remove samples from a patient. Clearly describe how each sample is obtained for each method. So simply for this, around roughly a page or so, or a page and a half, explain how a pap smear, aspiration, fine needle biopsy and surgical removal would be carried out within a biomedical setting. Again, include fine details such as aseptic techniques or the amount used, equipment used and the procedure. So M4, describe giving examples of the collection of cells for use in cellular pathology. Use those 4 examples, guys, to help you explain that. Task number 3, collected cells must be viewed using a microscope. To observe tissues, stains and dyes are added to use contrast. As we have done before, we have looked at crystal violet staining, and it's used to pigmentify different structures and highlight different areas within bacteria, for gram-positive and gram-negative bacteria. In this case, we're looking at the H&E stains and its purpose. So for this criterion, staining tissues requires preparation of the tissue for slide production. So first off, I would explain how to fixate a slide or a tissue slide for histological identification. Okay, first off, describe the process used to produce a permanent slide of a biopsy sample. So that's important, make sure that's addressed. And secondly, clearly explain the staining procedures used for the variety of tissue types. Okay? Images of the outcomes must be included for each stain identified to meet the criterion. So what I would do for that, guys, is include some form of histological diagram in order to help meet that criterion. Okay? Further point, using the links, I have also sent a document based around different types of staining and different types of outcomes you would expect. Also, important to identify what structures and what features you'd be looking for in the actual staining itself. Okay?